Hello, thank you for attending today's talk, Mental Health from a Medical Perspective. My name is Dr. Dan Cotoman, and I'm talking for you from Charlotte, North Carolina. What is mental health? I see it as a complex concept which includes the title of our conference, Mind, Body, and Soul. And we are going to defer the soul to the priest and church for more input into this. Well, let's come back to the mind and body concept. We are talking about biopsychosocial concept. And for a human being to be able to function normal, we need 33% from each. 33 times 3 means 100% in order for us to be able to function normal. I'm going to defer again the psychosocial concept to you, the therapists, which are PhDs, social worker, counselors, life coach. More life coach are in California, Hollywood. My job is to take care of bios aspect of this larger concept of biopsychosocial perspective. What means bio? In mental health is a theoretical concept which include a normal flux of brain chemicals in order to think and act normally. Let's start with saying few of the most popular brain chemicals called neurotransmitters. And those are serotonin. Lack of it can give you depression. Too much can give mania. Another one is dopamine or pleasure chemical. Too much is giving us schizophrenia. Adrenaline is giving us anxiety, noradrenaline, and many others. Let's stay with the most known ones in the brain, which are serotonin, dopamine, adrenaline, noradrenaline. And again, in order to have a normal function or act of our mind and body, we need the normal flux of production. Here is where the vitamins can play a role. Transportation of those neurons between different neurons and synapses. Degradation, regeneration, and storage of those chemicals. In order for those chemicals to be able to be transported, what we need neurons. And we have approximately 10 or 13 billions of neurons. And here I like to mention a little bit about the pruning concept, which is a process by which our brain is effectively cutting down those neurons around the age of 6 is the maximum, but also progresses from the moment when we are born until approximately age of 2021. Again, a very good reason why we shouldn't drink up to the age of 21, because we can affect this concept. Beside neurons in brain, we have synapses, which help us with neuronal connections. And usually here we have a number of synapses that can be 10 or 100 times more than the number of neurons. What can affect a normal harmony function or sync of those brain chemicals, neurotransmitters? Well, a lot of things. Between those is the object of our work are disease, which can be in the brain or in our body. And those diseases can start from conception or even preconceptional time. The example of those are mom or father who are too young or too old, financial issues, tobacco, drug, alcohol, psychosocial stressors, which can affect the father spermatozoids production or the mom ovules production, right? Well, The one of us who are lucky enough to make it for the utero, here where the fetus developmental stages starts, and what can affect fetus development? All of the above. Now, again, the lucky ones are able to be born, and we are going to the childhood and to young adult versus adult and older stages of our life, and what can affect us and what can trigger a mental illness. Again, all of the above. And the most common one are physical abuse, violence, tobacco, drug, alcohol issues. Let's talk with disease which can affect mental illness. And those can be tumors, which can be in the brain or body, can be seizures in our brain, stroke also in our brain, heart attack, which can give, for example, anxiety-like symptoms, obesity, which can give depression, chronic pain, but many other mental illness can be affected by obesity. Another disease which is way underdiagnosed, in my opinion, is sleep disorder. And here we can have obstructive sleep apnea, and for this we need a sleep study, which costs just approximately between $1,000 and $2,000. And if we are able to identify obstructive sleep apnea, then we need for the treatment either a CPAP or weight loss, or usually a combination of above, sleeping hygiene. Another disease are endocrinological problems, which are mostly known by a lot of people, are thyroid problem, hypo or hyperthyroidism, cortisol issues, which can be provided by our adrenal, are some glands, little glands who are above the kidney, or gonadal issues, which in men can give erectile dysfunction, for example, sexual issues. Others are metabolical issues, which are diabetes, hypertension, hypovitaminose, which are lack of certain vitamins. Those are very tricky ones, but are easy to diagnose, because if you check the vitamins, for example, B12, folic acid, we can easily identify and treat those. However, I like to mention here that a lot of people are going to the store and they're buying all kind of vitamins, trying to treat their mental illnesses. Most of them are not working, because a lot of them are destroyed by by our body in the way towards the brain, and very few are making to the blood and to the brain. Some examples of mental illness are the most known one: mood disorders, depression, bipolar disorder, anxiety disorder, including PTSD, alcohol, drug use, psychotic disorders, schizophrenia, schizoaffective disorder, developmental disorder, which are the autistic spectrum, the previous Asperger ones, mathematic and reading disorder, degenerative disorder, which are dementia and Parkinson, and former axis 2 disorder, which are antisocial, borderline, narcissistic, histrionic, just to name a few. Well, I like to give example here to some of the studies that we have in mental illness, and try to explain to you why it's so hard to find a right medication, to quantify this medication for the right patient, and to treat the right mental illness in our patient populations. One of the most well done and completed study was CATI study. CATIE, which was completed in September of 2005. And the name of the CATIE study is Clinical Antipsychotic Trial of Intervention Effectiveness Study, which was founded by NIH, which is National Institute of Mental Health, and compares effectiveness of older, first available in 1950, and newer antipsychotics available since 1990. The newer medication, which are called atypical medication, cost 10 times more than the older ones. CATIE study is the largest, the longest, and the most comprehensive independent trial ever done to examine existing medical therapy for schizophrenia, which is a brain disorder characterized by hallucinations, delusions, and disorder of thinking. What was the aim of CATIE study? The aim was to determine which medication provide the best treatment for schizophrenia. Many studies have tested new antipsychotic medication in schizophrenia. However, mostly were conducted by pharmaceutical companies to obtain FDA approval for a new drug, and they were usually short-term studies between 4 and 8 weeks, focused on limited outcomes, and enroll a narrow number of patients. They usually study one or two medications at the most, and they compare with placebo. What is placebo? Placebo effect placebo effect is an effect which is approximately 33% effectiveness. That means a patient comes to the doctor, comes to the clinic, and they receive a simple pill which can be sugar, and in 33% doing nothing else but giving to the patient just this pill, this medication is going to work 33% of the times. Again, let's come back to the CATIE study, which enrolled more than 1,400 participants and compare few of the newer medication, atypical antipsychotics, to each other and to an older medication, which is called typical antipsychotic. Was followed up for 18 months for long-term outcome. Was done in multiple sites in the United States and broadly represents real-life settings where patients receive their care. What were the results of CATIE? The results of CATIE study were helping doctors and people with schizophrenia to have extensive information on antipsychotic medication from a single, large, long-term study, direct compare drugs to each other. Enhance the knowledge available to guide treatment choices, and provide new information on effectivity and side effects of antipsychotic drugs compared to head-to-head, helping doctors to determine the appropriateness of specific medication in individual patients, and maximize the benefits while minimizing the side effects, increase likelihood that a person with schizophrenia will stay on medication. What are the results, again, of the CATIE study? They are giving us the necessary ingredients for managing the symptoms of schizophrenia with the aim of reducing the risk of collapse and keeping the patients with schizophrenia functional. The medication used in this study were FDA approved, no placebo treatment were used, and patients were randomly assigned to a medication, which means patient and doctor could not choose which medication to take. It was a double-blind, randomized clinical trial. Which medication were enrolled? It was atypical antipsychotics, olanzapine or Zyprexa, quetiapine or Seroquel, Risperdal or ziprasidone or Geodon. And the older antipsychotic was trilofan. I'm going to tell you later on why the trilofan was chosen versus Haladol, because Haladol is known by almost everybody, right? Patient continued to take this medication for 18 months or until the medication could not control their symptoms, or they develop intolerable side effects, or they decide to stop the medication. Again, why not Haladol? Because the Haladol was most widely prescribed medication before the atypical medication, atypical antipsychotics came available in 1990. It remained the most frequent used comparison drug in industry, sponsored clinical trials. Patients who take Haladol experience a high rate of movement side effects called extrapyramidal side effects, or EPS, such as rigidity and stiff movements, persistent muscle spasms, tremors, and uncontrollable restlessness. EPS are difficult to tolerate. Because of this reason, it's an unpopular drug, and perfenazine was less likely to produce EPS, was a better choice for CATI study. How did research measure how well the medication worked? For patients with schizophrenia, staying on medication is critical for controlling symptoms and preventing relapse. Previous studies have shown that antipsychotic treatment is far better than no treatment. Medication alone are not sufficient, but they are necessary to manage the symptoms of schizophrenia. And it is essential for a doctor to find a medication that is both effective and tolerable for a patient. The primary measure of treatment success in CATI was how long a patient benefited from those stay on medication before they or the doctor decide that it's time to change. And investigator recorded why a patient stopped the medication. The most important results of CATI study, the medication were comparable effective and associated with high risk of discontinuation due to intolerable side effects or failure to control the symptoms of schizophrenia. Olanzapine was slightly better, but was giving significant risk of weight gain, which can give diabetes as a side effect. And surprisingly, the less expensive medication, perfenazine, performed as well as the newer antipsychotic medications. The results of the CATI study, almost 3/4, which means 75% of patients stopped taking the medication before the end of the study, which is 18 months. And the reason, the medication didn't control the symptoms, side effects were not tolerable, patients choose to stop treatment for some other reasons. The most important take-home point from these lectures, if you don't remember anything else, is that is in a best control study at high regarded universities all over the United States, the patients stop taking the medication 75%. That means just 26% of the medication of the patients choose to stay on medication. Another study is CATI-2 study, which is completed in 2006, and here clozapine was offered to the patients who stopped their first antipsychotic because of the efficacy, which means the medication were not effective enough, and clozapine compared with atypical antipsychotics works. Clozapine is a good medication and should be the medication to go usually if a patient fails 2 antipsychotic medications. But again, clozapine has their own side effects. If you start this medication, you have to check the blood every week for 6 months, then every other week for 6 months, and then on monthly basis for the rest of the time when patient is on this medication in order to prevent agranulocytosis, which can give severe lethal infections. But again, clozapine is the medication to go if the patient fails 2 antipsychotic medications, usually is underutilized drug in my opinion. Some of the newer studies that I would like to mention, just for you to see how the studies are made, are a study made for Rexulti or brexpiprazole. Don't worry about this medication, it's a very complicated name. Again, this medication was approved by two pharmaceutical companies who band together, one from Tokyo, Japan, and another one from Denmark in 2015. And these two pharmaceutical companies, Anun's FDA approved Rexulti as an adjunctive treatment for depression and schizophrenia in adults. Rexulti was discovered by Otsuka and co-developed with Lundbeck. Don't worry about the name, I just want to give you an example. And the most important, the mechanism of action for treatment of depression and schizophrenia are unknown. It is possible they act on serotonin and dopamine receptors, however, not sure. Another medication, kind of a new medication for schizophrenia, is called Latuda or Lurazidone, and is approved for schizophrenia and bipolar disorder. For example, here Dr. Tisha Subs, who is MD and PhD from Stanford Medical School, says about this medication that is effective treatment in bipolar disorder as monotherapy or adjunctive treatment with lithium L valproate. And this is based on 6 weeks of treatment. And Dr. Subs receive funding, medication for clinical grants, consulting fees, travel expenses from, just to name a few companies, AstraZeneca, Lundbeck, this is the medication who made Rexulti, Merck, and also Dr. Subs receive royalties from UpToDate and Jones & Bartlett, formerly Contact Clinics. And another relevant disclosure is please see full study for a list of all authors' relevant financial disclosures. Now, you make your own thinking what is going on with those studies and why it's so difficult to find the perfect medication for our patient population. And when I'm seeing that, I would like to say from my clinical experience that I can bet effectively somebody with medication that are going to stimulate serotonin or affecting dopamine, still medication is not going to work. This is the reason why we also have for treatment of mental illnesses, we have you guys, and also we have ECT, which is shock therapy, we have TMS, transmagnetized stimulation, VNS, vagal nerve stimulation, we have ketamine clinics, and again we have you who we are hoping that you guys are going to manage the psychosocial aspect of mental illness. Okay. This is the end of my speech. Thank you so much for listening to me, and I'm looking forward to meet with you during the Q&A sessions. Thank you. Have a great day.